Thank you for the opportunity to present our work. We have no disclosures. Child physical abuse affects approximately 1 million children a year, of which 1,800 who do not survive their injuries. By identifying patterns of injuries and risk factors, children with child physical abuse may be identified earlier, preventing morbidity or mortality. Therefore, the purpose of this study was to develop a child physical abuse scorecard and retrospectively review its performance in patients with known child physical abuse. Using these published studies discussing presentation of children with child physical abuse, we developed an initial scorecard outlining common history and physical exam findings found in children with known child physical abuse. We then created a multidisciplinary consensus panel to discuss the components of the final scorecard using a modified Delphi method. This consisted of 3 rounds. Round 1 was face-to-face, where each member of the panel was asked to agree or disagree on each component of the scorecard. Only components that received 80% agreement were included. Round 2 was via email for continued editing and adjustment to the wording of the scorecard. Round 3 was another face-to-face meeting, which consisted of finalizing the scorecard. This process resulted in a proposed child physical abuse red flag scorecard. To test its effectiveness, we completed a retrospective review of 401 patients and 408 unique presentations of child physical abuse. Median age was 7 months. Most children were less than 1 year of age, and 89% had public or no insurance. Presenting with a delay in seeking care or a chief complaint of altered mental status, respiratory status, seizures, or apnea in a child less than 2 years old were the most common findings. The remainder of the findings are listed here. Physical and imaging findings were less common, with unexplained intracranial hemorrhage or hypoxic brain injury presenting 49% of the time, and bruising located away from bony promises 45% of the time. The remainder of the findings are listed here. Using a sensitivity analysis, we found that children who presented with at least 2 of the history findings and 1 physical imaging finding identified on the scorecard had an 81% chance of being identified. We reviewed the cases where child physical abuse was not identified by the scorecard, finding that in these cases, most of these children presented with a history of child physical abuse on presentation. We also found that head circumference greater than 85% was less common, and it was unclear if this was due to abuse or another etiology, and it was removed from the scorecard. Following these modifications, 100% of patients were identified. So in conclusion, the development of a red flag screening scorecard for child physical abuse using a modified Delphi method and validation with a retrospective review resulted in 2 history findings and 1 physical exam finding being 81% sensitive for identification. Modifications resulted in 100% of identification of cases. Prospective study is needed to confirm the performance of the scorecard. Thank you for the opportunity to present our work today.